Approval of minutes, January 14th was the last meeting, and I think we were all there at the last meeting.
I'll make a motion to approve the minutes of January 14th, 2020.
I'll second.
I have a motion, second. Is there any discussion? If not, all in favor?
Aye.
Who's taking notes? Susan, you?
I'm recording and
Okay.
she's gonna, yeah.
Okay.
So that was 3-0. Citizens' time, I think you're all on the agenda this evening. If there's anyone not on the agenda, there's nobody here for citizens' time. Chairman's report. I just want to report that last night was the town meeting. I attended along with our Director of Public Health, and we were called upon to discuss in reference to the zoning changes, proposed zoning changes, our new biological safety regulation, and both I and Susan did that. She did a wonderful job, and I want to again thank her. She gave up her evening last evening. We were not on the agenda, but she and I were both there. So thank you again, Susan.
So is that passed, that?
It
that
passed
bylaw?
unanimously.
Unanimously.
It passed.
And did they talk about the Board of Health regulations, the new regulations as well?
Yes, they did.
Yeah.
In passing. So, and
Great.
then we were called upon because many of the town meeting members had read all of the reports and the minutes that were going on that we had talked about. And in addition, I had received a lot of questions, and they did call upon us. So it
Great.
worked out well.
Awesome.
We have a subcommittee of reports, Ray Ave sewer lines, as well as our budget, and I'd like to hold that until the agenda items come up. And to that end, we go to variances tonight, and that is Cafe Escadrille, 26 Cambridge Street, variance modification. Mr. Murray. Well, it's been a long road, and I feel sorry about this whole situation, but we are having problems again. It's been reported multiple times to the board. With us this evening is Mr. Sanchez, who is the Director of Public Health, not Public
Works.
Public Works. Is that your title, John, Director of Public Works? And the Board of Health is the organization that enforces this, and however, the technical expertise does lie within the DPW, and as you know, because you are very involved in this and you're a professional, there continues to be problems with the system. And I'm going to just ask Mr. Sanchez, would you please come up and discuss or just report to?
Okay, good evening, everybody. Since the issues that have been happening at Ray Ave for the last few years right now, the DPW has been going more on a more than routine basis, or more like a sporadic basis. Actually, we're going monthly basis now to make sure that there is no backups happening at Ray Ave. This is the only place in Burlington where we have to do this to make sure that there's no backups in the sewer line. And every time we go, which is on a monthly basis, we find evidence that there is grease still within the Ray Ave, which is the town-owned sewer system. I happened to be there, I think it's 2 weeks ago now, when we did the last cleanup. I think it was on the 15th of January, so I could witness myself the level of grease that we can see, and there's evidence that there is grease within our lines as we clean it, as well as significant buildup in the sewer service coming out of the Cafe Escadrille. So,
Mr. Murray, had you seen the video? Would you want to see the
video, the pictures, but Susan and I discussed it prior to the meeting, and we've discussed it internally as well. So we obviously don't want to be, I don't know how it's contributing, but we don't want to be contributing to a problem. So, I mean, from our standpoint, we would request that, I guess revoked would be the right word, that the variance would be revoked, and we would go back to doing our cleanings more frequently to, try to, at the very minimum, bring it back, scale back what they have to do down on Ray Ave.
So, Mr. Chairman, we did have a subcommittee meeting, I think it was last week, wasn't it?
Yeah.
2 weeks ago, last week. Mr. Sanchez was there, and we did see the videos and the pictures. And I just wanted to make sure that we get the full picture, right? So this has been about 2 years that we approved the variance, 18 months, something like that?
I think it's actually longer than the 2 years.
It's over
'cause
longer than
of-
2 years?
Yeah.
So, and there is still grease or fats and oils, fog, coming into the sewer line, but albeit probably better than what it had been a year ago, right? We were having some significant backup, but we got it down to that baseline. There's been a series of events here. So I do think there needs to be either we pull the variance and if that's what you want to do, and go back to not using the protein matrix. But I think we came out of the subcommittee meeting saying that we're willing to continue to try to make it work, but we just need to make changes, whether we increase the dosage, whether we increase the dosage and clean it up, clean your external grease trap more frequently, maybe twice a year. So I just want to make sure we're clear. We're willing to still work with you if that's what you want to try to do over a period of time with a plan, right? But if you want to just, say, I don't want to use the protein matrix any longer,
Yeah,
and go back to your regular clean, and that's your prerogative, obviously.
From our point of view, we just don't know that, dosing it more is gonna be effective. From what we've seen, and again, I'm not a scientist, but the internal grease traps, they look fantastic every time we go out there. The external grease trap looks a lot better than what it did when we weren't doing any kind of dosing at all. But there is still buildup out there. It should be contained in the external grease trap. We don't see, buildup to the levels where it's full and should be overflowing or anything, so I don't really understand, how it's getting past that. But if I dose it more, I don't know that that's gonna solve the problem, and I don't wanna continue, if that's what's contributing to a problem downstream from us, I don't wanna continue to be that problem. So there really wasn't as much of a problem before we did this, so.
Albeit still a problem though, right? We still had issues on Ray Ave, maybe not we weren't cleaning out as frequently.
So we did, if I may, Mr. Chairman, we did have some issues prior to moving into protein matrix. And I think that's what precipitated you moving into protein matrix to see if it can better the situation over there. But we did have some issues prior to it, but we were not cleaning on a monthly basis either.
Yeah.
So, which
And
now.
that's not where we want to be, I don't think.
Correct, right, and the reason we're doing this is because I want to prevent a backup. If we were going on a monthly basis and we saw no evidence of grease, then we would have extended the time frame to a more reasonable, maybe every 6 months. But since we continue to see evidence, we haven't changed the monthly schedule.
Yep. Again, I support, I just want to make sure it's clear, we left the subcommittee meeting with, let's try a phased approach to a solution. And at the end of that, if it still wasn't working, if that's what you wanted to do, Cafe Escadrille has been working with us right along, and you've been very cooperative in trying to make this work, right? We thought it was a great solution for your, for the restaurant and potentially other restaurants. So again, my point of raising this, again, this is me personally, if you wanted to continue trying to do something with a plan, I would still support that, because that's what we discussed in the subcommittee meeting. But if you want to revoke the variance, that's your prerogative as well.
Yeah, there's a cost associated with it too, and
Sure.
it's also more of a timely manner to, I think if we went back to what we were doing before, and after 6 months to a year, we see that there's a significant improvement on Ray Ave, then we know that's kind of a test in itself, to know what we're doing. We can always revisit, or if a different product comes out, try something different down the road, but it's been going on a while now, so, and I just don't know, we've gone through like the different dosings and everything, I just don't know. I think one of the things with the exterior grease trap is that the way that the product is explained to me is it needs to be agitated, and I don't think once it's in that exterior grease trap, it's really getting agitated the way it's supposed to, so if I put more in, it might not have any impact, it might just be wasting and really kind of pouring it down the drain, as it were. So I think we'd rather stop back with the baseline and really try to nip it in the bud.
Well, it's a testament to your professionalism,
Absolutely.
and and your abilities that, that we worked with this, and you've been so cooperative, and your commitment both to the town and we thank you. It just didn't work.
Yeah, no, and we're appreciative of the opportunity to try it, and it worked with us as well, so, we don't want there to be a problem there either.
So, Director,
Yeah, so I just have a couple of questions. So are you gonna stop using the protein matrix altogether, even for the internal?
We haven't really decided that yet, but we would, even if we did continue to use it, we would commit to, still cleaning per regulation, which would be back basically to what we were doing before.
So, yeah, it would be either 25% or 3 months, whichever
For the
comes
internal,
first,
yep.
for the internal. So if you were gonna continue to use the protein matrix and you wanted to go beyond that 3 months,
Yep.
it would be a variance to go beyond the cleaning of the internal.
Yeah, no, we understand that.
Okay.
Yep.
Yeah. So, I think, Mr. Sanchez, though, did want to request that he do an initial cleaning, and I think that's what he should do now, is in February, do a cleaning and maintenance of the entire system and your lines. And he requested that if you could notify us, and therefore them, so they can be on site when that first cleaning occurs.
Sure. Yeah, we're at about 6 months right now anyway, so.
Okay, so you'll email me with the date and the time of when they're gonna come out and do the
Yeah,
cleaning?
I'll get it scheduled for the next couple of weeks.
Great.
So Susan, they don't need a variance for, if they're gonna use it continuing on the inside, on the internal?
If they're gonna use it and they're still gonna clean the internal at 25% or 3 months, whichever comes first, so they could go 3 months. But at 3 months, even if there was no grease in there, they'd still have to get it cleaned and maintained, unless they had the variance.
Gotcha.
so at this point in time, you'll decide, and we can always,
Yeah, I mean,
Talk
I
about
can
that.
keep,
Come back.
yeah, I can tell Susan, what our plan is and what we're still doing, and keep the
think
lines
it's
of communication open,
idea.
and, we'll work with you guys to try to get.
thank you. So do I need a motion to,
Mr. Chairman, can I, sorry, interject a little bit, because I do want to emphasize what, so we can all be on the same page, what Susan just said. Cleaning of the grease trap, as well as the service line, because I'm afraid that buildup that may exist, that may still
Yeah, no.
make its way through, so
Yeah.
I think we should get a baseline of everything clean. And on my end, before you vote, we will continue to probably clean up on a monthly basis, and then if we see that is an improvement, then we'll start creating a bigger gap until we get to what we used to do about every 6 months.
thank you.
Thank you.
So I need a motion to rescind the grease trap variance for 26 Cambridge Street.
So moved.
Do I have a second? All in favor?
Aye.
Thank you both.
Thank
Mr.
you.
Sanchez, thank you, as always, for supporting us, and Mr. Murray, thank you very much.
Thank you.
Thank you.
Thanks,
Good night,
folks.
everybody.
Yeah, have a good night.
We have a discussion, 10 Sunset Drive plumbing variance recommendation. Please come up and sign in, and,
Good evening, everyone.
yes, please.
Good evening.
Good evening. Susan?
Yes, so Mr. Miniello is here for a plumbing variance for 10 Sunset Drive for unapproved fixtures, which include 2 sink basins. And my recommendation is that you offer no objection to this variance.
Mr. Miniello, you've been here before.
Yeah.
And please understand, it's not us.
I know. I just, try to do something different and then go cut.
Please tell us before, well, I'll ask you, but I'm just kind of curious, how did the last variance work out?
Good.
They approved
Yeah,
it
they approve in 2 minutes.
2 minutes.
So you're gonna beat that, Ed?
So,
But
well,
after
this
they
would,
ordained about 2 minutes ago.
this is the plumbing board, correct?
Yes,
Approved it in
Is
2 minutes.
is that a state?
state, yeah.
Because this sink is purchased at Lowe's. I mean, it's.
Yeah, and
it's
evidently,
crazy.
there's a lot of products like that you can just purchase at Lowe's but are not on the approved list for Massachusetts
Makes no sense.
or anywhere else.
So just tell us quickly, Mr. Minielli, since you're on camera, and just so people know what we're talking about, you bought some new sinks, or is it just one sink?
Two bowls, sink, yeah.
Two,
One made with the granite and one with the marble.
and they're not on the state plumbing list for sinks.
Then, yeah, they're not on the approved list of products in the regulations.
Do we have any idea why they're not approved, or they're just not approved?
I wonder how often they keep the list up to date, maybe, could be part of it. Yeah. So is that, so our, not that you know the process, but our plumbing inspector goes and looks at the list to make sure that it's on?
Yeah, so if he says if it's not on the list, he'll say you need a variance for it.
We've been through this multiple times. Thank you for coming. So I need a motion to approve, to send a letter to the plumbing board that we have no objection for his two sinks.
So moved, Mr. Chairman.
Do I have a
Second.
second? I have motion and second. All in favor?
Aye.
Opposed? 3-0. Thank you for coming.
Thank you.
Thanks for coming in.
And we have a letter already.
Good night.
Good night.
Thank you.
Now, the 2021 Board of Health budget. This should be very interesting this evening. Who's presenting it?
I am.
Thank you.
So quick overview, proposed budget is 3.86% increase. The Board of Selectmen voted to approve an operating budget increase of 3.5% blended between the town and the schools. This is an overall guideline, and it's not a limit on individual budgets. The Board of Selectmen is requesting that expenses and special accounts are level funded, and the Board of Health proposed budget is for the 3.86% increase. We have a 0.9% increase in salaries. That's due to contractual obligations. No increase in expenses overall, but there was a decrease in contracted services and an increase in melt. A 26.19% increase in specials accounts, and it's because of a increase of 2% in mosquito control, an increase in household hazardous waste, which I'm gonna get to, and an addition of a BVRC special account. So our increase in total salaries, again, it was an increase in full-time salaries, decrease in part-time salaries. That was due to the retirement of Kathy Piccolo for next fiscal year. We had a decrease in overtime, slight decrease, and the justification is that is based on the factoring in of staff utilizing comp time rather than overtime. So most of the overtime budget, we don't really spend it. We end up giving it back because a lot of the staff just prefer to use the comp time rather than get paid. We had an increase in the elected and appointed, and that was due to an increase in the recording clerk salary. And that's
Excuse me.
contractual.
When you present this, could you say there's no increase in the elected officials, but there is an
Right.
increase in the appointed? I think that people should know. We were asked that question last year by Mr. Gallagher about our minimal salaries. or-
Stipend?
Yeah, stipends or what. So I'd like it to say no increase in elected, but there is an increase in appointed.
Okay.
Thank you.
The expenses, we had a decrease in contracted services, due to the ability of the associate health inspector to now conduct the pool inspections. So now she's a certified pool operator. She's able to do that, so we were able to go down on that because we don't have to pay contracted inspectors in the summertime to do those inspections. And we had an increase in melt due to an increase in the enrollment in professional organizations. That has gone up, and the cost of trainings has gone up. We have a lot of staff who have a lot of certifications, trained registered sanitarians, certified pool operators, soil evaluators. So all those certifications, we need to keep up and go to trainings to do that. So our special accounts, a 2% increase in mosquito control. This is usual, this is usually what they say. The increase is gonna be every year due to They have to increase their paying their workers as well. And it's level funded, so our services are gonna stay the same. It would include adult mosquito surveillance, larval mosquito survey and control, and adult mosquito control. The household hazardous waste, so a 56.2% increase in hazardous waste. At this time, we usually use Stericycle to do our, as the contractor of our household hazardous waste. We were told that they may not be doing this again next year, and due to that, it's likely to drive up the prices because Clean Harbors now is on the state bidding list. They're one of the higher priced companies, and the other companies are going to likely increase to kind of catch up to their pricing. So we expect, although I'm not sure, I don't know what the percentage is gonna be, but maybe a 30 to 40% increase overall in the disposal of the household hazardous waste. So I did put some statistics together. So this is showing our fiscal year counts from 2015 to 2019. And as you can see, the difference in the car count between what we count, which is the clicker that we use up the front, and what Stericycle counts is significant from fiscal year 16 up until fiscal year 19. So this is for the entire year, so this is both events. So fiscal year 15 seemed to be more reasonable count. Now, we're counting with the clicker. Stericycle is telling us we had this many half cars, this many full cars. So we're taking their word for it as far as what they said we had. So these are the numbers that we were given. But as you can see, realistically, it's likely that fiscal year 15 is more accurate than the other years. Because we do consolidate cars if we can. There is cars leaving for propane, for light bulbs, but seems unlikely that we would have that many cars leaving for those things. So I had to, go
How
ahead.
do they do the count, Susan?
I'm sorry.
How do they do the count, Steri?
They have the
Cycle.
same way that we do. They have somebody there
So I
who's
thought-
collecting and
okay.
checking off how many full cars, how many half cars that come through.
And the decision of half car versus full car is their decision. And so we're in we thought we were in the ballpark, but
Yeah. So I had to find a way to try to figure out how I'm gonna estimate what this could cost next year using a different vendor. So to do that, I used the fiscal year 15 numbers for full and half cars. So this is what I came up with. There's 3 different companies on the state bid list for this year, likely to be on it for next year. This is their current rates, the first column here for full and half cars, plus they charge a one-time setup fee. So for the expected next year, I increased those rates by 30%. And then I projected out the fiscal year 21 rates for full and half cars at the expected next year rates. So the totals, as you can see, range from 38 to 49,000. One of the other reasons why they said that their rates would be going up would be that they said that they now have to do PCB testing of hazardous waste, which was not required in the past and is required or will be required next year. So they anticipate an increase in rates because of that as well. So we talked about it at the, this is prior to, we found out this information after the subcommittee meeting was held. I talked to the chairman and we made the decision to put $50,000 in the budget for household hazardous waste, which is the 56% increase in that line item.
Are the companies that you're looking at now that are in the bid, do they have the same list of what we're used to, what we'll accept from?
Materials, as
Yes.
far, they're pretty much all the same as far as what they accept, yeah.
Okay.
Susan, on this, I think it's a good slide, I think, for, Ways and Means, or whoever else we need to show it to. It might be good to show what the price per full and half car was for Stericycle when you came up for this last
Okay.
year, just so they can look at it for a comparison.
I called, and I'm sorry he's left, but Mr. Sanchez, and we talked about these prices, and we talked about the prices that the town pays for regular trash and for recycled trash. We pay a lot of money for our trash to be taken out of Burlington. And what's really surprised me is how much we pay for recycled materials to take out of Burlington. People think around town, I've asked a few people, that we make some money on recycled materials. No, we don't. We have to pay by the ton just to take out our recycling. And recycling is a great thing to do. It's good for the environment, it's good for the planet, but it costs a lot of money. And we don't make anything at all. In fact, it costs us to recycle. So I think all of this is going to come forward this year. I think it's going to be an issue that we need to talk about. I said to Mr. Sanchez, what if we didn't do household hazardous waste and people just threw the material away? And tongue in cheek. And he said, which another surprised me, although we did have an issue once with a radioactive trash truck, that they do spot check. They spot check the trucks now, and if it is filled with household hazardous waste, they will turn it around and send it back to the community. So we really don't have a choice here. And it's the right thing to do. Thank you.
We also added a BVRC special account line item. So before I talk about how much that's for $1,000, but I wanted to talk a little bit about, just kind of as a reminder, is what the BVRC does for us and for the town. So some of the things that they work on is they assist us with public health initiatives, things that we couldn't do if we didn't have the volunteers to help us out. Things like the annual health fair. We have 10 to 15 volunteers who come to that. The bladder cancer screening at the fire department, they come and help out with that. Household hazardous waste collections, they do traffic. They do the greeting in the front, collect the propane tanks. Stop the Bleed trainings, we have nurses who are trained as Stop the Bleed trainers, and they help out with that. And then the flu clinics for seniors and for children. They also help out with that. Those are some examples.
And most of all, which you don't have listed here, God forbid there is an emergency in Burlington, that they are available. And we do ask them on occasion, we do survey. In the middle of the day, we'll get an email, are you available right now if there was an emergency? So I think that's very important that we add that is.
I got it as a slide, there's a couple more.
Maybe you should put that up front. Maybe you should get that up front at the beginning.
Okay.
All right? Because
We'll
it's
hold
the
that question.
Burlington, Volunteer Reserve Corps. And it's reserved because we may need them.
Right. They collaborate with partners, and they provide services to the residents of Burlington. So the American Red Cross blood drives, we have a collaboration with them because of the Volunteer Reserve Corps. They do blood pressure screenings at the library and the Council on Aging. They do a Matter of Balance program, that's a collaboration with Leahy. And they do first aid stations at Celebrate Burlington and the Turkey Trot. So that's a collaboration with the Recreation Department. They train and prepare for the public health emergencies. So most importantly, it's the emergency dispensing site drills, because in a public health emergency, we would need nurses and non-medical people available to make sure that the public got vaccinated or received the appropriate medications. The shelter drills, they've done shelter drills with us and have trained in sheltering. CPR, AED, first aid, psychological first aid. They prepare themselves so that they can help out in an emergency, and they go to these trainings. And we have many volunteers who take advantage of that and who train year after year in these different types of trainings.
And how many volunteers do we have?
Right now, we
predominantly
have
from Burlington?
168. So this slide shows the number of hours that our volunteers spend at trainings and events. So events would be, trainings is what I just talked about, the CPR, AD, psychological first aid, and events would be everything else. So for this one, on average, from 2016 to 2019, our volunteers averaged 1,171 hours per year on public health events and 634 hours per year training. So we can take that and extrapolate it into a dollar value, which from the US Bureau of Labor and Statistics, you can get values for nurses, psychologists, doctors, pharmacists, and non-medical volunteers. So we took that information and extrapolated it to the dollar value. And that equates to an average dollar amount to the town of $31,464 in public health events and $18,451 in training. So that's a total of almost $50,000 per year going back to the town in labor from the volunteers. So the BVRC is funded through grants. We get grant money. We get money from the CDC Public Health and Emergency Preparedness Grant, $25,000 for an emergency preparedness administrator. We also get DPH and CDC FEP grant money. So right now it's $5,000 per year for support of the Medical Reserve Corps. We expect that to increase next year to $7,000 in fiscal year 2021. But the grant money can't be used for everything. So in recent years, the grants management manual has changed, and there are some things that we can't use grant money for currently. And that includes refreshments for trainings and drills, apparel, and recruitment items. So we can have volunteers who come, say they come to the EDS drill, that's from 10 in the morning until 3 o'clock. You have to give people a break, you have to give them lunch, you have to give them refreshments, and we can't expect our volunteers to come and not give them something. And the same thing kind of goes for training. Sometimes a training can be a full day training, and we have to give a break, and we need to have refreshments available and whatnot. The apparel is the polo shirts and the hats and the backpacks, which we always have given out to new volunteers, and that's to identify them as a volunteer. So if they're out and about, we use it to advertise our organization, but also it's to identify them as a Burlington Volunteer Reserve Corps volunteer.
And they'd also wear it in case of emergency too,
In case
right?
of an
So
emergency.
An emergency,
it'd be a
yeah,
benefit
they can-
For
they-
someone to go to.
That's the most
Yeah,
important
I
reason
agree.
why.
And then certain recruitment items are what they call promotional items. So things that we might hand out at a recruitment table, that's no longer covered by the grant. So we're growing, and it's necessary to provide increased opportunities for training and participation in drills. Our numbers, they go up and down per year, but if you look at it on average, we have more volunteers now than we did 5 years ago. And we need to make sure they are trained and ready for an emergency. And if we held no drills and had no trainings, then they wouldn't be ready to respond. So the recommendation from the subcommittee was that we do a BVRC special account line item with funding for $1,000 for items that are not covered from the grant. Also, too, I don't know how long the grant funding is gonna be available, so it's good to have this account in case for some reason grant funding was not available.
I have a question. I think we need to think about this for the future. I know that when we get donations, it goes directly into the general fund. Can we set up a revolving account where businesses or individuals can make donations to the BVRC?
We have to be very careful with donations, especially with our department, because we do regulate a lot of these companies. So we regulate a lot of we regulate all the restaurants and some of the companies in town, and we want to make sure that there's no conflict of interest there with
If we
regards
want,
to
but if an
donations.
individual would like to make a donation to BVRC, can they do that?
I would have to look into that, but I believe if they were an individual resident, not really, not a business, and they would, or if they were business and there was no conflict that existed, they may be able to. That's something that we could look into. I know other town departments do have donations that they accept, so I don't think that that would be out of the question. But again, we just have to be careful with the conflict of
And it's
interest
probably
thing.
a way, I don't wanna say around that, 'cause it makes it seem like I'm hiding something, but it's probably a way of eliminating that conflict of interest between a donation and a general BVRC fund. You know, just off the top, there's a few things I can think of. Again, not to skirt a conflict of interest, is all I'm saying, but
But if there's a
way
way,
to do
Yeah.
it right, yeah.
if somebody wants to thank or some reason will us $100 million, I think there should be a way of placing it with, with some type of revolving account.
Right. I'll look into that. I'll try to see if I can
Thank
find
you.
out about that. Yeah. So one of the other requirements, as far as what we need to provide to Ways and Means, is our other funding sources. So here I've listed the grants that we've gotten last year. Again, we may or may not get them next year, but we've got the 25,000, this, from the FEP grant, this 25,000 for emergency preparedness administrator, for 1,700 for cell phones, 4,260 for 2 Microsoft Surface Pro laptops for emergency preparedness activities, which we haven't gotten yet. But those are going to be used at the EDS drill, because we found out last year that the laptops and the iPads just didn't work, and we need some better laptops for that. Money to go, 3,600 approximately for 2 staff members to attend the NACCHO Emergency Preparedness Conference, which is coming up at the end of March. Approximately 1,200 for 2 staff members to attend the MHOA conference. Also, the DPH and CDC FEP grant, we got $5,000 for support of the Medical Reserve Corps, again, which is going up next year. $2,000 from Leahy for the annual health fair. Approximately 4,352 to replace our Board of Health Universal Waste Shed. And then we have the revolving account. So with the revolving account, our current expenditure limit is 30,000. Right now, we have a current balance of 37,000. And for our fiscal year 20 deposits to date, we've deposited 12,250, and our expenditures to date is 19,237. So I expect the deposits to go up because we still need to get reimbursements for the last flu clinic season. So any questions?
I don't. I have none. I think that you did a nice job. I think all 3 of us have seen this before tonight. I think it's important that people watching see our budget. We do get a lot done. We do a lot in this town, and we protect this town for the budget that we have, which is one of the smaller budgets within the community. With that, I need a motion to approve.
So before, what are the next steps now for?
First, we need a motion.
Okay.
And wait a second?
I approve,
Yes.
yes.
Second. Okay, now discussion. Go ahead.
So what are the next steps to,
So
for the budget for the approval?
Next month, I should be hearing from the Ways and Means Subcommittee, and then we'll have a subcommittee meeting with Ways and Means. And then in March, the beginning of March, I think it's the 4th. March 4th, we go to the Ways and Means meeting, and then after that, it's town meeting in May.
Thank you.
Any other questions? Then I'm going to put it to a vote. All in favor? Aye. So I can sign those today, or?
Yeah.
Very good. All right, staff reports, environmental engineer.
Evening. I just wanted to highlight that our annual mailing for registrations for hazardous materials was completed a couple weeks ago. It goes to approximately 125 companies that, we register what they have on site for hazardous materials, and I do their annual inspections. So that has been completed for the year.
Are there any questions?
I have one, Mr. Chairman.
Please.
The 5 Lowell Street, can you talk about that septic abandonment and,
Yeah, so we got a pumping record, as we're supposed to, that a septic system had been pumped. And when a call was also initiated from a realtor asking to confirm that the septic system had been removed, and I had no paperwork for it. So we talked to the DPW and confirmed that they did in fact tie into sewer, but they did not
they left the tank
contact.
there?
No, they removed the
They
tank,
removed
but they didn't call us or me to have it witnessed. So I sent a,
And it's a residence.
yeah, and so the Title V regulations require that Board of Health witness the abandonment of
Sure.
septic tank, and they didn't do that step, so I sent a letter informing the contractor who did the abandonment that that was not in compliance.
Gotcha. Thank you.
Is there any penalty for that?
We didn't issue a fine. This was a, first time occurrence. We would, if we were to issue a fine, it would be under the non-criminal.
Yeah, and it would be, and under the Title V regulations. So we have this person on record, or this company
Sure.
on record, and if they do it again, then we will issue a fine. So this doesn't occur that often.
So first one that, we've seen.
It wasn't a builder or a speculator,
It was not a company I have ever dealt with.
okay.
So,
Actually, I have one more question.
Sure.
On 207 Cambridge Street, so driving by, I noticed, I don't know, last week or 2 weeks ago, they put a whole bunch of rock salt, they ground it up, and I know they're working on installing the new retention basin, or whatever you wanna call it, or,
so they applied to DOT.
was that that was gonna be my question, was
They,
that approved?
yeah, they got I guess we'll call it a tentative approval from the DOT, contingent on submission of a traffic plan. And they, but the approval from DOT didn't come till after
The
construction
freeze,
season.
right, yeah.
So they're looking to do the actual install in the spring, early summer. And I think they're going back and forth on just edits to the traffic plan with DOT right now.
So how's, why, I don't understand what the traffic study.
They have to close one lane of,
Parking?
3A while
Oh,
while
to
they're doing the
build that, I
tie-in.
got you.
While they're doing the tie-in. And, so they'll have to,
I understand now.
They have to
I
send-
thought, because I'm like, well,
no,
the retention
no, just for the
basin's
tie-in
behind the
part,
building,
yeah.
on the side of the building.
So they have
I
to submit a
gotcha.
whole traffic
Makes
control
sense.
plan, and it's a lot to it, so.
Do you think, so they have to submit that back to the DOT? Do you know if they've done that? I just want to make, because we were afraid last year, and they were working with us, but we were afraid they were gonna miss the freeze, which they did this year, right? So I just want to make sure that as soon as they're able to install the fix, that they can get out there as soon as possible.
I believe so. I think they have their other approvals from DOT.
Okay. All right. Can we just make sure that we're
I'm
on top of them? I know you are, but I just, we were working with them, and they've been very, very cooperative. We were hoping to get something in before this season, because we had a mess last year. And I just want to make sure that as soon as they're, the weather permits, that they are in the ground.
They've been cooperative, but
Yeah.
I don't think they anticipated the length of the DOT approval process.
Sure.
So, but
Understand.
I think they understand it now.
Great.
And I probably, I'm in contact with them twice a month.
I know they've been great to work with, so.
Just want to point out, we have more and more demolitions in town
Yeah, I know.
than we've seen in a very long time, and a lot of houses are coming down.
do a lot of demo inspections.
Very important. You just can't tear something down. There are a lot of hazardous materials and a lot of inspections that go into it before we expose the environment to that type of material. Do I have a motion to approve?
Second.
All in favor?
Aye.
Brings us to the supervisory nurse.
Good evening.
Good evening.
Just a couple of things. We have some nursing students, again, from Northeastern University for this semester, and we have plenty of flu vaccine, so if anybody, it's not too late to get a flu shot, so we're seeing a kind of a moderate flu season with both types A and B, so.
We had a tragedy in the state where a young person died of the flu. And the reports on television, radio were sure to say that there's plenty of flu vaccine and it's not too late. So if any of you need a flu shot, please call the Board of Health office at 270-1955. Please.
Oh, okay. No, go ahead.
I just have, in your report, you identify a public health information table per month. And is that publicized? I think that'd be great.
I put that on
You
social.
put that in your social media, great. I just noticed we have one for December and January, but just the location, that's great. Glad to know it's publicized.
Yeah, and actually, I reached out, emailed to the employees in the town, and I had got word back from somebody in town hall and also at the library to put some of that information over there for the public as well, so.
That's great.
Works for that.
Thank you.
And again, we are working with the Burlington Fire Department and doing bladder cancer screening. I think we have a great relationship with the fire department, and I applaud that. Thank you. Any other questions?
No, that's it for me. Thank you, sorry.
No, I was just gonna mention the bladder screening, so thank you.
Do I have a motion?
So move to approve the
Supervisory.
supervisory nurses report.
Second.
I have a motion, a second, to approve the supervisory nurses report. All in favor?
Aye.
Aye, 3-0. Associate Health Inspector, it's so nice to see you.
No, it's been a while,
We don't get to
huh?
see Samantha.
Yeah, this is a big report, huh?
It is.
So I guess the most recent thing that I just completed was doing all of the tobacco inspections as far as educating on the new regulations. So all of those have been completed, so everyone should be on the same page now, hopefully, unless the state decides to change their regulations again. Hopefully they, keep them kind of the same. And the other thing is I've been working with a couple other people in the office to come up with a training schedule for the BBRC for next fiscal year. So that's been taking up a lot of my time recently. And hopefully we'll have a good set of trainings and speakers for our volunteers next year. That's pretty much it.
So, and you're a certified pool operator now? Excellent. So was that a long course, like certification course?
It was 2 days,
Yeah.
but it was half days. But it was kind of difficult.
Have you done any pools there? I guess the season's coming up.
Yeah, so last, in the summer, me and Marlene both
Oh, good.
went out together, and she trained me the way, we do everything here, and then I went out and started on my own, so
Awesome.
next summer we should be good to go.
Is there an exam involved?
Yes, there's a test. Lots of questions.
Mm-hmm.
Lots of math.
And just because you can smell
Oh,
the
you're gonna
chlorine.
pick this up, are you? I thought we were gonna skirt that. one
Dr.
is-
Saltzman is sick this evening with the flu, but I'm sure that he would say, that we have to keep up the tradition. Just because you can smell the chlorine doesn't mean it's properly chlorinated.
That is very true.
Dr. Saltzman, if you're watching, I kept up the tradition. Questions? Well, thank you for everything, and you're doing a lot of diverse work, and including, we talk about getting speakers, which is not easy. And so I appreciate that. Do I have a motion to approve the Associate Health Inspector's report?
So moved?
Second.
I a motion to approve the Associate Health Inspector's report. All in favor?
Aye.
Thank you again. And last but not least, the Director of Public Health.
Yeah, so I just wanted to talk a little bit about some stuff that's upcoming. Next week, we have a tabletop exercise that is organized by the Emergency Preparedness Region 4AB. It's going to be in Burlington, but it's also going to involve some other cities and towns in the region. So we have about 5 or 6 cities and towns coming together. And we're gonna have our partners there from police and fire. And what we're going to be discussing, what the tabletop is on, is critical staff dispensing. So now we have to put into our emergency dispensing site plan. In the past, we've had anthrax in there, but now we're getting more involved with vaccinations and putting vaccinations in our plan. And we need to have numbers in there for how many critical staff, meaning police, fire, public health personnel, would need to be vaccinated in a pandemic to keep everything going and keep the town moving and being able to respond to the emergencies. So we reached out to our police and fire partners, and they're gonna be coming, and they provided us with numbers that we can put into the emergency dispensing site plan, and we will be going through the tabletop exercise with them, and that is on, that's next week.
Do you have the date?
It's February 4th, 12:30 to 4:30. And then we also have coming up, the Harvard School of Public Health is going to be doing a presentation on worker safety and emerging infectious disease. That's going to be held on February 19th from 6 to 8 p.m. And that's something that they're coming out free of charge to do that. I actually happened to see that somewhere, and I just took advantage of having them come out to do it. And then we will have a food code training review that Marlene and Sam and Christine are working on. They're gonna do a presentation to the restaurants, and that's happening on February 19th from 2 to 5 p.m. at Burlington High School.
And that's on the same day as the,
That's the same day as the emergency infectious diseases at night. That's during the day.
and just so people know, there's going to be a section on chemicals, which chemicals not to mix and keep apart, and our environmental engineer is going to be doing that. And in view of some of the recent events, I think that's great. Thank you, Christine.
It's a great idea.
Any?
I'm just curious, are you getting any calls at all about the coronavirus? Have you heard anything?
We did get one call from a school that was concerned, and we had to provide an education to them about that. But other than that, no. CDC is holding some phone calls, upcoming, like almost on a weekly basis, for the next month or so. So I'll be sitting on those calls just to find out what the newest updates are, so.
Well, we shut down the mall this week.
The restaurants. not the
Restaurant, not us.
Did they, I thought at one
With
point,
some of the restaurants.
at some point, they were considering shutting the whole mall down because of the water situation and
Yes.
fire.
Yeah, so there was a water main break outside. Well, it really affected the area of the food court and surrounding area, first
What
and
day was
second
that
floor.
again?
I think it was it
2 days ago.
Monday?
Monday.
Yeah, Monday.
Yesterday.
Yesterday.
It was yesterday.
Blending together. I don't
It was yesterday.
So, yeah, so Marlene and I went out there, and the restaurant, most of them, which was great, most of them had closed on their own. They knew enough to do that, so we're working on educating them to do that. If there's things like no water, no electricity, they have to close. So we did find, we had to ticket one person, but that's going to be one restaurant. That's what we're going to be doing in the future now, because we feel that, it is important for them to know this. They should know that if they have no water, they need to close. But most of them did. So it worked out well. We just kind of did a sweep through, make sure they were closed.
Any other questions?
Not for me.
Well, thank you for everything you did, and with this budget, which was a lot of work.
Excuse me.
I need a motion for the approval of the Director of Public Health.
So moved?
report.
Second.
I have a motion, a second, all in favor?
Aye.
3-0. Is there anything else on our agenda tonight? Nothing on our agenda, anything else you'd like to discuss? If not, everybody, please stay warm. Please wash your hands. It's the best thing you can possibly do to prevent infectious disease. Stay warm again, and good night. Meeting's adjourned. Actually,